Hey, welcome to The Explainer. Today we're going to look at the spine, but from a pretty unique angle. We're diving into a homeopathic perspective on how to deal with some of those really common, and let's face it, super stubborn spinal problems. Let's get right into it.
You know that feeling, right? That nagging ache in your neck, that sudden twinge in your back that just refuses to go away? We've all been there. But what if the solution, the real answer, lies somewhere you'd never think to look? Let's find out. All right, so here's what we've got on tap for this explainer. We're going to start with that everyday neck pain, then dig into what happens when stiffness gets more serious. We'll also touch on acute injuries and why a good diagnosis is key before we wrap up with this big idea called the constitutional approach. First up, let's talk about those really common complaints. We're zoning in on the cervical spine, the neck. That's where a lot of this trouble starts. But as you probably know, it rarely stays put.
Yeah, one of the biggest issues with neck problems is that the pain likes to travel. It kicks off in the neck, sure, but then it radiates down your arm, creating this really unique and disruptive kind of discomfort. It's so much more than just a little muscle tension. Okay, so this is where it gets really interesting. This shows how specific symptoms are kind of mapped to potential remedies. So, for instance, if the root problem is bone spurs, those are called osteophytes, phosphorus is considered. For that traveling pain we were just talking about, the kind that shoots down the arm, the approach might point to magnesia phos. And for this very specific pain that actually shifts from one side to the other, Paris quadrifolia is one to look at. Now, let's build on that. We're moving away from that more common pain and into something much deeper and more challenging, a level of stiffness that can really, truly change someone's life. So, this is a really serious condition. It involves inflammation that can actually cause the vertebrae in your spine to fuse together. We're talking about a deep, unyielding stiffness that severely restricts your movement. This is not just waking up sore, it's a profound loss of flexibility. So what's the homeopathic game plan here? Well, you can think of it like a flexibility toolkit. There's a specific group of remedies considered, and each one is aimed at helping restore some flexibility to those stiffened joints. They're all designed to combat that deep-seated rigidity, and each one has a slightly different profile to address the nuances of that stiffness. Okay, let's switch gears completely. We're moving from those chronic, long-term conditions to the sudden, acute trauma of a spinal injury or even a fracture. And as you can probably guess, the approach here is going to be quite different. First things first, figuring out the type of injury is absolutely crucial. A simple injury might just be about muscles and nerves. But a compound fracture? That's a whole different ballgame. You're dealing with a broken bone plus all the potential damage to the tissues and nerves around it. This really illustrates a two-step strategy. Step one is all about addressing the fracture itself, using a remedy like Symphytum, which is well known for its role in bone healing. But you don't stop there. Step two is about strengthening the bone from the inside out, using something like Drosera to help rebuild its natural strength. Now here's a really critical point. None of this is happening in a vacuum. Effective homeopathic treatment isn't just about playing a matching game with symptoms and remedies. It requires a much, much deeper understanding of what's going on. This really gets to the heart of the philosophy here. The core idea is that this isn't guesswork. You can't really treat a problem effectively unless you have a clear diagnosis, and that means you've got to look inside the body. And that's exactly why tools like X-rays and other modern scans are seen as an essential first step. They help you pinpoint the actual physical root cause. Is it disc degeneration? Is it inflammation? Is it a tiny fracture? Getting that clear diagnosis is the foundation for any kind of effective treatment plan. And that brings us to our final, and honestly, maybe the most important concept of all. It's an idea that completely shifts the focus from the specific ache or pain to the entire person. This slide just nails the core difference. On one hand, you have symptomatic treatment, which is basically a this for that approach, right? You have pain, you take something for the pain. But constitutional treatment, that's about addressing the entire individual's entire state of health, their unique makeup, their underlying tendencies. So the real endgame here isn't just to make the back pain go away. It's to find a single, comprehensive remedy that resonates with the person's entire constitution. We're talking physical, mental, and emotional. The spinal problem is just seen as one symptom of a deeper overall imbalance. And that leaves us with this really profound question, doesn't it, in any approach to health? What does it actually mean to treat the person and not just the disease? It's a powerful idea, and it pushes us to think about healing in a much more holistic and truly personalized way. Thanks for joining us for this explainer.